I wanted to share with you today a case of a neck lift that I performed recently. This is a husband of a patient of mine, and so I've known him for about 7 years. And during that time, he's been complaining increasingly about his neck and how he wanted something done for it. He found out that I do a lot of smart lipo on necks, and he immediately asked me if I could help him by doing that procedure. And I told him, I really don't think it's appropriate because you've simply got too much loose skin in the area. He accepted that, but he also decided that it was time to move on and do something because his neck was bothering him quite a bit. He said it made him look older than he felt. And therefore, we decided to go ahead and do something called a formal neck lift. Now, the neck lift that I like to perform is called a Corsett Platysmaplasty. And in that operation, we make an incision from the earlobe in this area, behind the ear, and then down along the hairline this way. That gives me great access to the entire neck down in this area. I also like to make an incision right in the chin crease in this area, and that gives me access down the center of the neck so that I can remove whatever loose tissues are in that neighborhood. And so you see him here in the post-op. This is about 3 months later, and after performing that operation, he certainly has better neck definition. His jawline definition is much nicer. You really can't see any incision in the chin crease, but his neck has been lifted, and that turkey neck, as he called it, has been eliminated. He's much happier with the jowling, which, although he still has a little bit of modest jowl here, it certainly is better than the pre-op photograph. And he is much more content with the way he appears right now. So one of the things that was important to this patient, and I think important to every patient coming in for facial cosmetic surgery, is that he didn't want anyone to know that he had this work done, and he certainly didn't want to look like a different person altogether. I'm not showing you his complete face for obvious reasons. I want to respect his privacy somewhat. But if you take a look at him, I think even though I've covered his eyes, you can appreciate that he does not look like a different person at all. The only issue really is that the jowling is a little better, and the neck hanging skin is gone in the post-op picture. So I don't think we changed his facial features. We simply made him look a little bit younger, and it's a more fresh version of him. He tells me he looks more like he did 15 or 20 years ago. I'm going out of my way here to show you what he looks like on downward gaze, and that's because many of us spend a good part of our day looking down at our desk or down at our work. I know that I do, whether I'm in the operating room or sitting at my desk doing paperwork. And that is the position that many of our colleagues see us in. So it really makes his neck look significantly worse, I must say, and it also enhances the jowl. And so post-operatively, I think that you can appreciate he's got a much cleaner look in this neighborhood. Now, part of the reason for this cleaner look is that Corsett Platysmaplasty that I talked about, and that's because I made the incision in the chin crease and was able to put 3 separate rows of sutures, just like a corset is created, up and down the neckline in order to improve and tidy up the area and give him the smooth neck skin that you see here. So I hope you'll agree that he does look better in his post-operative pictures than he did pre-operatively. And I also hope that you all think he looks relatively natural and not necessarily as if he had some work done. I do try to make people look as natural as possible.